Hello, I'm Dr. Sudhansu. I'm DNB consultant physician. Today I'm here to talk on diabetes. So diabetes is all about blood sugar. So what is blood sugar? Blood sugar is the concentration of sugar in our blood. So it has range from normal range from 80 to 126. So what is diabetes? If somebody's fasting blood sugar goes beyond 126, then it is known as diabetes. Or if somebody's 3 months average blood sugar goes beyond 6.5, then it is known as diabetes. So now what are the types of diabetes? There are especially three types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes occurs in any age, mostly in children and adolescents. And type 2 is more common in adults, and type 2 accounts for 90% of all diabetes. And gestational diabetes means diabetes that is diagnosed or that occurs during pregnancy. Initially, that lady had no complaint of diabetes, but once she gets pregnant, she shows features and her lab values are suggestive of diabetes, which is known as gestational diabetes. Now, what are the symptoms of diabetes? Symptoms of diabetes is mainly categorized into two parts: classical symptoms and other symptoms. In classical symptoms, we have polyuria, means excessive urination; polydipsia, excessive thirst and drinking a lot of water; unexplained weight loss. And in other symptoms, we have increased appetite, blurring of vision, frequent urinary tract infection, frequent skin infection, dry and itchy skin, numbness and tingling sensation of hand and feet, and sometimes there might not be any symptoms also. And diabetes is diagnosed accidentally in course of lab investigation. So these are the major symptoms of diabetes. Now talking about the risk factor and complication for diabetes. So the first and foremost risk factor is physical inactivity, not having regular exercise, sedentary lifestyle. Number two risk factor is first degree relative or genetic connection. Third risk factor is some ethnic groups like African, Asians, Pacific Islanders. They are also at high risk of developing diabetes. Another risk factor is hypertension, low good cholesterol, PCOD, HbA1c, glycosylated hemoglobin more than 5.7, obesity, insulin resistance condition, and history of cardiovascular disease. So these are the major risk factors for diabetes. And what are the complications? Complications are cardiovascular complications, heart issues, nerve complications, diabetic neuropathy, kidney complication, diabetes nephropathy, retina complication, diabetes retinopathy, food damage that we know as diabetes foot, hearing disorder, and to the most sometimes some people also show, elderly age group of people show Alzheimer's and other neurological disorders. So these are the risk factors and complication for diabetes. What precaution we should take so that we will not become diabetes in future? First and foremost thing, we should cut down sugar. Sugar should be completely as minimum as possible. Cut down carbohydrate, working out regularly, drinking a lot of water, trying to lose weight and bringing down BMI for Indian scenario less than 23, quitting smoking, and watching the size of portion of meal that we eat. And if somebody asks how much exercise should I do, the answer to this question is 150 minutes per week. You can do it either in twice, or you can plan it accordingly. This is the minimum amount of exercise somebody should do at least per week. So what is exercise? Exercise is any activity that increases your heart rate and maintains that increased heart rate. Suppose I climb stair, my heart rate goes down, I sit down in a couch, and then it again falls down. So that is not an exercise. Suppose I walk in a park, my heart rate goes up, and I maintain that increased heart rate for more than 30 minutes, then that duration of time will be calculated as exercise. So exercise is all about maintaining increased heart rate for more than 30 minutes. So that duration will be counted as exercise. Now the question arises, what kind of diet we should eat so that we prevent ourselves from diabetes, and if we are diabetes, what kind of food we should eat. First and foremost thing is that we should try to consume low glycemic index food. What does this indicate? This indicates those category of food that do not increases our blood sugar immediately. Gradually it increases. Whenever any food increases our blood sugar immediately, it won't take much time for it to drop also. So that fluctuation in blood sugar level makes us hungry again and we have craving to eat again. So that thing we should not do. We should avoid sugar. Sugar avoid means direct sugar as well as hidden products. Direct sugar means we should try to take bland tea, bland coffee, and hidden products means all biscuit, cookies, rusk, juices, wherever there is sugar, we should try to avoid as much as possible. Try to increase fibers in our diet, vegetables, spinach, salads, so many other leafy vegetables. So we should try to include in our diet. And our portions should be balanced, and our diet should always have good quantity of protein. So that protein is responsible for building up of damaged organ, damaged tissue, damaged cells. So the adequate amount of protein does not allow our body to maintain that damage that happens throughout the day or on a regular basis. So coming to what kind of food we should not drink. We should not take sugar containing drinks. We should not take any product that has trans fat. We should try to avoid white bread, rice, pasta. We should try to avoid fruit flavored yogurt, sweetened cereals that we take in breakfast, that comes in the advertisement. Some cornflakes. They are cornflakes, but usually they add sugar for taste. That should be avoided. Flavored coffee, honey, maples. Honey and maples. There are several myths about honey, whether we should take or we should not take. In my opinion, we should not take because most of the time 90% of our honey brand is adulterated with sugar syrup, so we should try to avoid. We should try to avoid packaged snacks, chips, namkeen, bhujia, fruit juice, and so these are the basic things we should avoid. And what we should eat, that I have already spoken: low glycemic index food, lot of vegetables, fibers, salads, and protein, and maintaining the daily requirement of water intake. And apart from medicine and insulin, things that helps us to keep diabetes under control are knowledge. We should know what diabetes is. Motivation. We should have good motivation so that we exercise regularly. We follow proper lifestyle. Number 3 is regular checking of blood sugar at home. Not regularly means at certain interval, so that we can roughly know whether our sugar is under control or not. If it is going beyond most of the time, then we need to approach doctor. Another is family support, so that everybody understands what the problem is, and we should all support helping the individual in the family with diabetes to live proper life. So overall, I would like to say diabetes is not a disease, it's a problem, and it can be well settled and well improved with proper lifestyle and motivation. Thank you so much. Now coming to the medicines that are used for diabetes. There are two categories of medication: oral medication and insulin. Oral medication, we have different class that I would not like to discuss here, but with the diagnosed diabetes, usually we start with one class of medication and we follow up regularly to see whether one medication is enough. If it is not enough, we keep on adding another class of medication, another class of medication, and we keep on following up. And after one level where oral medication seems to be insufficient, we try to add insulin also. And insulin, we have especially three types: short acting, long acting, and intermittent acting. So we try to sometime give short acting, sometime long acting, and sometime mixture of short acting and long acting, depending on the necessity of the situation. So apart from medicine, we need to things that maintains